Welcome to Sepsis 911 and Aging. My name is Karen. I'm speaking to you today about sepsis, something that you may not have heard of before you joined us today, or don't know much about. You are not alone. So why am I doing this presentation? I am a registered nurse who cares about saving lives and raising awareness of sepsis so that you can do the same. According to the latest survey conducted annually by Sepsis Alliance, the nation's leading sepsis nonprofit organization, nearly 1/3 of American adults have never heard the word sepsis, and many who have heard the word don't really know what it means or how important it is. The goal of today is to help improve that statistic. So in the next 30 minutes, I'm going to cover what sepsis is and isn't, the symptoms and stages, as well as prevention, how it disproportionately affects older members of our community, and what to do if you think you or a loved one has sepsis. So let's get started. What is sepsis? It's your body's toxic response to an infection. It kills about 270,000 people every year in the US. That's more than people who die from breast cancer, prostate cancer, and AIDS combined. When you have an infection, your immune system works hard to fight it. Sometimes it can fight the infection on its own, and other times it needs help with drugs like antibiotics, antifungals, or antiviral medications. For reasons we don't understand, sometimes instead of fighting the infection, your body starts to attack itself. This is sepsis. It's the #1 killer in hospitals in the US. However, most cases, 87%, begin in the community, not a hospital. This means that most of the time, sepsis develops from an infection someone gets in everyday life, as opposed to the result of a hospital procedure or complication. How does this affect older adults? Here are some statistics that might surprise you. More than 80% of sepsis patients are 50 years of age or older. 70% of hospitalizations for sepsis are for people who are 60 years old. Adults age 65 plus are 13 times more likely to be hospitalized with sepsis than adults younger than 65. Older adults who are in the ICU for septic shock tend to be sicker than their younger counterparts and stay longer. Older sepsis survivors are at higher risk for long-term cognitive impairment and physical problems than others their age who are treated for other illnesses. 76% of older sepsis survivors are more likely to be discharged to a skilled nursing facility rather than their previous living arrangements. People may refer to sepsis as blood poisoning, but that term isn't accurate anymore. Sepsis is also not an infection and it's not contagious. It is your body's reaction to an infection. It is also not rare. In fact, about 1.7 million people in the US develop sepsis every year. In the healthcare community, sepsis isn't necessarily a commonly used word, which is surprising because it is not an uncommon illness. Unfortunately, doctors tend to not use the word sepsis, instead saying things like complications of pneumonia or complications of an infection. Even death certificates often default to the original diagnosis, which could be cancer or another illness, stating complications of. If doctors and nurses aren't using the word sepsis, it's more difficult for patients and families to learn about it. We all need to start using the word sepsis. Say sepsis. I'm going to take a break from talking for a few minutes and show you a video called Sepsis in Older Americans, Saving Lives Through Early Recognition. This video, produced in partnership with the Alliance for Aging Research, explains what sepsis is, infections that can trigger sepsis, and why older people may be at higher risk of developing sepsis.
Every year, more than 1.7 million Americans develop sepsis, a life-threatening medical condition that arises when the body initiates a powerful immune response against an infection. Anyone can get sepsis, but 2/3 of all sepsis cases occur in people over 60. Sepsis kills more people in the United States than breast cancer, prostate cancer, and AIDS combined. Older adults, especially those with chronic health conditions like heart disease and various types of cancer, are more likely to succumb to sepsis. However, early recognition of sepsis symptoms can save lives and reduce the risk of long-term effects. Sepsis is caused by bacterial, viral, parasitic, or fungal microbial infections that trigger overwhelming inflammation and blood thickening. Normally, the body's immune system targets invading microbes with a tempered response. However, in sepsis, the body overreacts, triggering a cascade of chemical messengers that cause inflammation within blood vessel linings. When this happens, small blood clots form, first at the site of infection and then throughout the body. Widespread inflammation and blood clotting impede oxygen and nutrient delivery to tissues and organs, resulting in organ dysfunction. An infection may begin in an organ like the lungs or kidney, or be introduced through an open sore, surgical incision, or invasive medical device like a urinary catheter or feeding tube. Common symptoms of sepsis include fever, rapid heart rate, and rapid breathing. The organ affected by the infection often dictates the other signs and symptoms of sepsis. For example, if the lung is the primary site of infection, as in pneumonia, the person may experience fever coupled with shortness of breath, painful coughing, and discolored mucus. Not all infections develop into sepsis. However, progression from a localized infection to full-blown sepsis can occur within hours. Therefore, it is important to swiftly recognize the signs and symptoms of an infection that's out of control. When an older person becomes septic, fever may be absent. In fact, the opposite can occur with the development of a cold, clammy skin temperature known as hypothermia. Older patients are also more likely to exhibit sudden mental confusion or delirium as a major part of their presenting signs, along with fatigue, malaise, weakness, sudden shortness of breath, poor appetite, chills, dizziness, and low blood pressure. When these symptoms occur, coupled with an infection, it is time to seek immediate medical attention. Older adults may be resistant to urgent medical care, but timely medical treatment is imperative to increase survival, since for every hour delay in appropriate treatment, the risk of death increases by up to 8%. Sepsis becomes more dangerous with age, and treatment is more likely to involve hospitalization and admission to the intensive care unit, or ICU. 70% of sepsis hospitalizations are in adults 60 years and older. Older adults admitted to the ICU for sepsis are also generally sicker, require longer lengths of stay, and may experience significant long-term cognitive impairment and physical limitations. Among older adults who do survive sepsis, 76% are more likely to be discharged to a skilled nursing facility, unable to return home. To limit sepsis-causing infections, seniors, their loved ones, and caregivers should receive flu and pneumonia vaccinations and practice good hand washing and good personal hygiene. Wound dressing and nursing care should use sterile techniques whenever feasible. Sepsis is common, deadly, and costly. It affects older Americans in disproportionate numbers. Weakened immunity, recent surgery, skin ulcerations, and chronic diseases such as diabetes, cancer, autoimmune disorders, or malnutrition make seniors more vulnerable to sepsis. To help reduce sepsis deaths in seniors, practice preventative strategies that reduce the spread of germs, know the signs of sepsis, and seek early treatment. Together, we can save lives.
And anyone of any age can get sepsis. In addition to being older, there are others who are at higher risk, including people with chronic illnesses. such as diabetes or COPD, also known as chronic obstructive pulmonary disease. The very young are also at a higher risk, and on the other end of the spectrum, the very old are at risk. People who have weaker immune systems, which can be caused by taking medications like steroids or chemotherapy, are also in this group. Why are older people at higher risk? There are several reasons. For example, older people may have one or more chronic conditions that increase the risk of sepsis, take multiple medications, some of which lower the immune system's ability to fight infection, be admitted to a healthcare facility where they may contract an infection, have fragile skin that tears or breaks easily and can become infected, sustain a fracture or other serious injury from falling. Also, if you've had sepsis before, you may be at higher risk of developing it again. It is also important to understand that as we age, we may not show signs of infection as we did when we were younger. As mentioned in the video, there are other signs that may indicate that sepsis is developing. For example, the signs and symptoms of a urinary tract infection, UTI, are usually burning when urinating, an increasing and urgent need to urinate, and cloudy and foul-smelling urine. However, many older people who have a UTI do not show those symptoms, and the first sign that something is wrong is they suddenly become confused or disoriented, or if they have cognitive issues already, they deteriorate. Therefore, an infection may not be detected in its early stages. There is no one symptom for sepsis. Instead, it's a compilation of symptoms. Sepsis Alliance put together an acronym to help you remember the most common ones. Remember the word time, as in time is of the essence in recognizing, diagnosing, and treating sepsis. T, temperature, higher or lower than normal. I, signs of an infection. M, mental decline, could be confused, sleepy, or difficult to rouse. E, feeling extremely ill, like the worst they've ever felt. At first glance, these symptoms may seem quite vague, like those of the flu. It's when someone has a combination of these symptoms, paired with an infection, that sepsis should be a serious concern. If someone you know has an infection or is very sick with any of these symptoms, suspect sepsis and seek medical help right away. Just like strokes and heart attacks, time is vital. The chances of surviving sepsis drops by as much as 8% every hour there is no treatment. Sepsis is a medical emergency. Call 911 and be sure to let them know you are concerned about sepsis. What causes sepsis? An infection. To quickly recap, we've already talked about how sepsis is your body's toxic response to an infection. When you have an infection, your immune system works hard to fight it, but sometimes your immune system turns and starts to attack itself. This is sepsis. We already know that infection may lead to sepsis, but I also want you to know that this infection can be caused by bacteria, viruses, fungi, or even parasites. This is why it's particularly important to be aware of the signs and symptoms of sepsis if you've been injured by a cut or a bug bite, you've had an illness like food poisoning or pneumonia, or you've had an invasive procedure such as surgery, a urinary catheter, or even an intravenous line. Anytime your skin is broken or something is introduced into your body, you are at risk of developing an infection. That being said, sometimes people who develop sepsis never knew they had an infection, or the doctors never identified what the infection was. Sepsis, when left untreated, can progress to septic shock. Sepsis can progress very quickly, which is why it's so important to know the symptoms and get medical attention right away if you suspect sepsis. Let's talk more about sepsis. So someone has an infection and their body is trying to fight it, but turns on itself. Now this person has sepsis. We've already talked about these symptoms, and they're important to reference again as we talk about how sepsis progresses. Sepsis is when you have an infection and a combination of any of the symptoms, such as high or low body temperature, rapid breathing, confusion, and change in mental status. Sepsis is a medical emergency that requires urgent attention and rapid treatment for survival. Sepsis can be treated, and in many instances, lives are saved by using existing and proven protocols. As many as 80% of sepsis deaths can be prevented with rapid diagnosis and treatment. Septic shock is a severe and potentially fatal condition. It occurs when sepsis leads to life-threatening low blood pressure. It is most difficult to treat. Remember, I shared that if you have septic shock, your chances of survival drops as much as 8% every hour if you are not treated. Sepsis does not discriminate, and anyone of any age can get sepsis. There are those who are at higher risk, including people with chronic illnesses such as diabetes or COPD, also known as chronic obstructive pulmonary disease. The very young are also at a higher risk because they don't have fully developed immune systems yet. On the other end of the spectrum, the older adults are at risk too, as are people who have weaker immune systems, which can be caused by taking medications like steroids or chemotherapy. All of this increases the risk of sepsis. Also, if you've had sepsis before, you may be at a higher risk of developing it again. Sepsis sometimes makes national headlines, especially when celebrities are involved. Each of these well-known people died from sepsis. Muhammad Ali, who had Parkinson's disease, passed away in June 2016 from septic shock. Actress Patty Duke experienced a ruptured intestine and passed away in March 2016 from sepsis. Muppets creator Jim Henson passed away in May 1990 from sepsis. Singer Mel Tillis had diverticulosis and developed sepsis. He spent almost a month in ICU before his death in November 2017. Pope John Paul II passed away from sepsis and multiple organ failure in April of 2005. He had had many infections over the last few years of his life and developed a UTI just before his death. Singer Etta James developed a UTI and died of sepsis in 2012. Microsoft founder Paul Allen had cancer and was immunocompromised. He died of sepsis in 2018. Unfortunately, the treatment needed to save people from dying from sepsis can cause long-term consequences, such as post-sepsis syndrome, PTSD, organs not working properly, and even amputations. Post-sepsis syndrome is a condition that affects up to 50% of sepsis survivors. They are left with physical and or psychological long-term effects, such as insomnia, getting difficulty in going to sleep or staying asleep, nightmares, vivid hallucinations and panic attacks, disabling muscle and joint pains, extreme fatigue, poor concentration, decreased mental cognitive functioning, loss of self-esteem and self-belief. There are survivors who are diagnosed with PTSD, post-traumatic stress disorder, following their treatment. In severe cases, amputations are required after surviving sepsis. The medications given to keep the blood flow going to the major organs can cause tissue death in the extremities, causing them to turn black. Often this happens in the fingers and toes first. When too much tissue dies, it has to be removed, which sometimes means amputation. After surviving sepsis, many experience impaired cognitive or physical function. This is particularly significant among people over the age of 65. In fact, on average, older sepsis survivors experience 1 to 2 new limitations in their activities of daily living after they were hospitalized. Sepsis can't always be prevented, but we can reduce our risk of contracting an infection, which reduces our risk of getting sepsis. Taking antibiotics when prescribed for bacterial infection and following the directions. Taking them as often as prescribed and for as long as prescribed. Not taking someone else's antibiotics because you think it may be the same infection. Not asking for antibiotics for an infection that is not bacterial. We reduce our risk of infection by following some simple steps, including frequent and thorough hand washing, keeping wounds clean and dry, avoiding people who are sick, and avoiding going out when we are sick, receiving recommended vaccines, and taking care of ourselves when we do get infection. That means taking them as often as prescribed for as long as prescribed, not taking someone else's antibiotics because you think it may be the same infection, not asking for antibiotics for an infection that is not bacterial. Up to half of sepsis deaths could be prevented by timely recognition and treatment, and many complications could be avoided. In order to advocate for yourself and your loved ones, you first need to know that sepsis exists. That's why sepsis awareness is vital, and hopefully after today, you know more about sepsis and can recognize the symptoms. In addition to recognizing sepsis, it is important to express your concerns to the medical team and ask for clarification if anything is not understood. You can also visit sepsis.org for even more information and resources. Thank you for sharing your time with me. If you're looking for more resources, you can go to Sepsis Alliance's website, sepsis.org, email them at info@sepsis.org, and find them on social media. Made possible in part by an educational grant from Merck Co., Inc., this video was recorded by Qualidigm.